Let's also move on to the capital city of Delhi, where Chief Minister Arvind Kejriwal raised an alarm in the city, witnessing a whopping 10,372 cases in the last 24 hours. Arvind Kejriwal urged citizens to maintain the COVID protocol and stay at home as much as possible, while the CM also reiterated that the lockdown is not the solution. However, if the stress on Delhi hospitals increases to an extent that it is not able to deal with the numbers, then of course stricter curbs will be inevitable. Chief Minister once again reiterated the appeal to the centre to open up vaccination, as 65% of the population, according to the Chief Minister, are below 45 years of age, and therefore the CM has urged that the vaccination should be opened out to all age groups. Alok joining us live. Alok, over to you to give us a clear picture of what the ground realities are in the national capital. The Chief Minister, of course, talks about stricter curbs, but seems to be against the idea of a lockdown. What are the facts and figures in terms of the COVID situation in Delhi?
See, Afrida, in the national capital, the corona cases are increasing rapidly, and in fact, within a week, it has reached up to 10% of positivity rate. Means that it's in a double figure. In fact, around 10 days ago, the positivity rate was below 1%, but now it has reached 10%. So definitely, it's a cause of concern. Now the beds are also being made. Several measures are being taken. Yesterday, only Delhi Chief Minister, Delhi government had announced several restrictions, and also related to whether the transportation as well, government and as well as the private offices, staggered timing. Pools are now also being shut again. And we all know that schools are already shut, night curfew. Delhi government has requested the people to follow all the COVID appropriate behavior. But today's press conference, the Delhi Chief Minister, which did today in the afternoon, 3 points he made, and that is really the cause of concern. 10,000 cases came in last 24 hours, and 100% the positivity rate has also gone up, more than 10%. Not only that, he also said that 65% of people, those who tested positive, are below 45 years of age. This is really one trend that is coming out in the national capital. What kind of variant is, as of now, government has not told to the media, but this trend is coming out. Those generation who are not affected at that point in time in the first, second, third wave. Now, because in Delhi this is the fourth wave, so in this fourth wave, younger generation are getting affected due to corona very much and in high numbers. And the third thing, he has requested the people to also, if they want and if there is any condition, that critical condition, they also prefer government hospital, because in private hospital the number of beds are being exhausted rapidly. So this is what the press conference was about. Delhi Chief Minister, he also said he does not want to impose any kind of lockdown in the national capital, but if the situation becomes very much problematic, then definitely he may in fact put the lockdown as well. So right now it is the duty of the people, if they don't have any important work to do, then they should remain at their homes and also follow the social distancing and other COVID appropriate behaviors. Back to you.
All right. Yes, of course, the COVID protocols must be strictly maintained. But what are the options that the government can explore if the health infrastructure comes under pressure? If the hospitals are running out of beds, the immediate strategy, it seems, would be to impose stricter norms. But Alok, also at the moment, can you share with us the exact status of the availability of beds, especially ICU beds and ventilators in the city of Delhi?
Well, if you see the COVID app, which is showing around 11,728 beds are there in the national capital. My video journalist Amil will show you that 11,728 beds are there. Out of those, 6,359 are occupied and vacant are 5,369. If you see the ventilator beds, 1,153 are total. These are ICU with ventilator beds. 846 are occupied and only 307 are vacant. This is the figure which the Delhi government is giving to us through the Delhi Corona app, and this is especially made so that the people could not get confused where the beds are vacant or not. And in fact, in this procedure, you can also identify the hospital as well. But if you go more deeper into this app, you will find that in private hospital, the beds are being exhausted rapidly. So this is also the cause of concern, and that is the reason government is also requesting the people that in government hospitals also the facilities are being given, whether it's COVID beds, whether it's ICU beds, and ICU with ventilators, all facilities are there. They should also preferably go to government hospitals as well. So right now, Delhi government has requested, we have to wait and watch that what situation will happen. But definitely, one thing I would like to mention here is that situation is completely, totally like November last year, when there was huge number was coming. In fact, in November last year, 9,000 cases had come, but this time it has already crossed. So 10,000 cases has come in 24 years, so 24 hours. So this is really what we can say, that little bit trouble situation in the national capital.
All right, thank you, Alok, for joining us. I am now joined by Dr. Subhash Salunke from the Public Health Foundation of India on the phone line. Good evening, Dr. Salunke. Thank you so much for joining us here on Mirror Now. The big question that everyone is asking right now is that what would be the most effective strategy to break the chain of transmission, since the numbers are on the rise? The government, it seems, has a tendency to resort to lockdown as a last resort. Where do you stand on this issue, sir?
I think nobody, including government, likes to have the lockdown as an intervention. However, please try and understand, we are at a stage where, earlier it was clearly indicated if you are getting 10,000 cases in Delhi, 7,000 in Mumbai, 9,000 in Pune. That means most of the urban cities where congested population is there, the cases have tripled or quadrupled literally in 3 weeks. Number two, worst part is it is now impacting the younger age group. Children are getting affected. Transmission is so quick and rapid because there's definitely a viral mutation has taken place, even though government is not coming upfront and sharing to what extent this mutation has taken place. But irrespective of what type of virus it is, whether mutated or original one, the transmission can be definitely interrupted, provided we try and ensure that everybody follows COVID appropriate behavior. But our people are wonderful. They are paying for attention than their life as far as the purchasing of the vegetable is concerned or evening stroll is concerned. Now that is the ground reality. Unfortunately, people are pushing government towards lockdown. As far as Maharashtra is concerned, I am definitely confident that even though Honorable Chief Minister and every minister will not like to have the lockdown, nobody, including opposition, is in favor. But there is no alternative. Tell me, what is the alternative? You want to ensure that people don't die, more and more cases don't occur, then what else? We have to break the chain. And if you don't pursue and follow the appropriate behavior, government is left without any other alternative but to follow the strictest lockdown. And I'm confident, rather, in a fashion, that people are not leaving any alternative to the government but to impose lockdown. It will be for a span of about a fortnight. Please remember, this won't be the lockdown like in the first phase. If people cooperate and support, see what is happening now. If you have 10,000 cases in Delhi, state multiplied by 25 times. That means 250,000 people, between 200 and 250,000, 2 lakh से 2.5 lakh cases, लोगों को already infection हो चुका है. That means what you are staring, Delhi is staring at not less than 2 lakh people having coronavirus in their body. And these are the guys, some of them, most of them are asymptomatic, some of them are mild symptomatic, and some of them are rapid spreaders. That is what we call as the super spreaders. Now, these are the people who are going to spread to their family, their neighborhood. And if you are in the market. That means if you are a person having a shop owner, this shop owner is going to spread to a number of people. So what do we do? Government has no left. The government has no alternative. No, whatever those people who are against lockdown, let us ask
Yes.
them, do you have any other alternative? If that is implementable, doable, and likely to ensure that everything of non-lockdown is also there, and also transmission of interruption of transmission takes place, there is no one. All those fellows who are opposing lockdown are only academicians, hypothetical, and they do not give any concrete suggestion to the government. Let them come out with concrete suggestion which is implementable in city of Mumbai or Delhi or in Pune or eventually in every state. What is happening in the Uttar Pradesh? What's happening is going to happen in West Bengal. Please mark my word. These elections are going to be a great negative factor for transmission of this disease in every state. And there is no alternative for the state government but to impose to take stricter measures.
Yes, absolutely. Dr. Subhash Salunke, thank you so much for explaining to us your point of view on this. And we are in fact speaking to a host of experts to get their views out on this so that people get a clear understanding how delicate the situation is and how important it is at this stage for the country to make the right moves. Rajiv Das Gupta, from the Center of Social Medicine and Community Health, also with us. Good afternoon, Dr. Das Gupta. The question we are addressing today is that, of course, for a state like Maharashtra, it's being suggested now by the head of the government, the chief minister itself, that we are already at a stage where the only option left now to explore is a lockdown. Where do you stand on this issue, given the nature of the pandemic and the fact that this is a second wave with number of differentiators, which Dr. Salunke also pointed out? Would that be an effective step at this stage?
Yes, I have been listening to Dr. Salunke in the last several minutes, and as always, Dr. Salunke brings a whole lot of wisdom and practice. To a certain extent, I do agree with Dr. Salunke. The important point is that the lockdown decision has to be a town-by-town, city-by-city decision, which should in turn be informed by the extent to which health services are getting stretched for that particular unit, as well as the mortality figures. The case fatality rate in several districts of Maharashtra is close to the benchmark of 4. Even in the first phase, the same set of districts, the mortality hovered around 4 and 5%. This is equally true of some districts in Punjab, the previous phase also, this phase also, and some districts of Gujarat too, among the high incidence states. So to that extent, the lockdown decision has to be district by district, town by town. At the same time, the fact is that despite a plethora of investments that India did in various COVID control and research aspects, we simply haven't invested in social, behavioral and communication research, which is still the mainstay, given that the basic behavioral interventions are the cornerstone of COVID prevention. And that's something that ought to be strengthened. This can't happen in the next 10 days. This is an emergency situation, but COVID is not going to go away. We are looking at the pandemic in a 3 to 5 year time frame, and I would argue that social behavioral research, survey, etc., has been neglected, but it shouldn't be neglected because it is extremely central to the big picture.
Yes, absolutely. And therefore, like you said, it has to be decided on a town-by-town, district-by-district basis, depending on the nature and the number of cases. This has to be, according to Mr. Das Gupta, a more localized decision. And that is also something that has been said a lot about how it has to be a micro strategy, a micro containment strategy. Both containment and mitigation is equally important. COVID-appropriate behavior is still the mainstay. Thanks for joining us, Mr. Rajiv Gupta, and giving us your views on this.